Welcome to the Sarah Finkelstein Show, where the next 10 minutes can change your life. Also on Spotify, SoundCloud, and iHeartRadio. Here's Sarah.
Have you heard about the multitude of changes to Medicare coming in 2025? And if you have not, stay tuned. You're going to learn what you need to know. So because of the Inflation Reduction Act, there have been a lot of changes happening to Medicare, which starts in January of 2025. Some good stuff, some not so good stuff, pros and cons. And that's what life's all about, right? Nothing is absolutely perfect. There's pros and cons. So let me tell you what these changes are. First of all, changes occurring to the Medicare Part D drug plan. The Inflation Reduction Act has made it so that if you or someone you know is taking expensive medications, your copays for all of your medications is going to be capped at $2,000 for the year, starting in January. So some people are going to save a ton of money. But what also is happening, my clients are experiencing, for those that have a standalone Part D drug plan, some of them have seen their premiums increase. So some people benefit, some people do not. Because of these changes, if an individual does have expensive medications and they are capped at the $2,000 for copays, what happens to the rest of the cost of their medications? You probably guessed it. The drug plan has to eat it. The Medicare Advantage plan also has to eat it. And that is why some Medicare Advantage plans are not going to be around in 2025, which means what? It means that if you or someone you know is on a Medicare Advantage plan that is not going to be available in 2025, they have to make changes. They gotta hop off and hop on to a different Medicare Advantage plan. But did you know that because they are losing their plan in their area, they also, in most cases, have an opportunity to sign up for a Medicare supplement plan without, I underline, without having to answer any of the health questions. And that's huge because some people who are on a Medicare Advantage plan would like to go back to original Medicare, get a Medicare supplement plan so that they could see any provider without having to check networks. And if they do not have very good health and they cannot pass what's called the underwriting, that's the health questions part of the application, they may not be able to go back to a supplement plan. So this is very, very important. Some people are going to benefit by the fact that their plan is no longer available in 2025. This is a rare opportunity for those individuals that do want to go back to original Medicare and get a Medicare supplement plan that pays all of their copays. And that's really very, very powerful. What happens when people sign up for Medicare initially, they could choose a Medicare supplement plan or a Medicare Advantage plan. But if they choose a Medicare supplement plan, every plan does have the health questions attached to the application. But when you're brand new to Medicare, those questions are waived, so they do not have to be answered. Another issue that some people will be facing is we know a lot of people continue to work beyond age 65, beyond their Medicare eligibility year. and they have a choice to stay on their group health insurance as long as that group health insurance has more than 20 employees and as long as it is considered creditable coverage. Well, some of those people next year, their plans will not be considered creditable coverage. And if they stay on those plans at work, they will be hit potentially with a late enrollment penalty when they do eventually sign up for a drug plan or a Medicare Advantage plan. So this is a very, very busy time of year as the annual enrollment period is now in full force for the next 6-7 weeks. And people are talking to their friends, their neighbors, their buddies down at the pool, asking them for their advice and their tips on what plan they should sign up for. Now, let me ask you, do you go to your car mechanic to ask for investment advice? Do you go to your house painter to ask about dental problems? No, of course not. Silly question, right? Just to illustrate the point. Work with a professional who can assist you. As an example, I just had a conversation the other day with a gal that's going to be turning 65 soon. And she was talking with a friend of hers who lives in another state who has a Medicare Advantage plan. And she's asking for this plan because her friend is very happy with it. However, the plans are different from state to state and even sometimes from county to county. So just because there's a wonderful Medicare Advantage plan in another state, wherever it might be, does not necessarily mean that that same plan is available in your zip code, because these Medicare Advantage plans are based on zip code areas, and they could be very, very different from one state to another state, even with the same carrier. So did you know that the original Medicare and the Medicare supplement plan is the government Medicare plan, which allows you to go to any Medicare provider anywhere in the country? And that is many times very important to individuals, especially as we get older and maybe we're not as healthy as we used to be when we signed up for Medicare. So there are pros and cons to all kinds of plans. People will ask me, well, what's the best plan? There's no such thing as the best plan. There is an appropriate plan for you based on your needs and your budget. But there is no such thing as a best plan because, as I said, there are pros and cons to all the plans that are available. When you're working with an agent, you would be better off to work with an independent agent as opposed to a captive agent. So if you're not familiar with this terminology, a captive agent is someone who works for a particular company and they can only sell you that company's products. So when you work with an independent agent, that person is working for you, getting you the best plan for your needs, as opposed to trying to fit you into whatever their company offers. And you know what? It doesn't cost anything to have the help of an independent agent. As a matter of fact, you're better off having someone that you can call upon when you have questions or have issues. What I've seen for this coming year is that every Medicare Advantage plan has a maximum out-of-pocket number. Every one of them does, whether it's an HMO or a PPO, there is a maximum out-of-pocket. We call it the MOOP, MOOP. And I've seen some of these plans increase tremendously in their MOOP for next year. So as long as one is extremely healthy, of course, you could save money on a Medicare Advantage plan. But when one is not as healthy as they used to be, and they're going to different specialists, and each time they go to a specialist, it's another copay, and they have to be concerned about whether or not their provider is still in network. Because remember, when you're a member of a Medicare Advantage plan, the providers are always subject to change. So you might be seeing Dr. Smith for many, many years, and Dr. Smith participates in a particular Medicare Advantage plan. So you enroll into that plan. There's no guarantee that Dr. Smith will still be on that plan a year from now or even next month. The providers are always subject to change. And also for those of you that are on Medicare Supplement Plan F as in Frank, which is the most comprehensive plan of all, that particular plan is no longer available for people turning 65 after 2020. Now, if you have a Plan F, you can stay on that plan. You could keep it forever if you want to. However, because there are no new people signing up for Plan F because they cannot, it becomes a closed pool of insureds. And what happens when there's a closed pool? It's smaller, and it gets smaller and smaller over time, which means what? It means that increases are likely to be much higher on a Plan F than on the next best plan. I shouldn't say best, there I go. The most appropriate plan is Plan G, and there's only one difference between those two plans. And oftentimes, it still makes economical sense to make the switch. So if you have an agent that you're working with, ask them about that so that you can have more money in your pocket. And don't we all need and want more money in our pocket? If you have questions, feel free to reach out to me. I'm more than happy to help. And as I said, this is a very, very busy time for all agents that work in the Medicare space. So if you have somebody that you're working with and they haven't called you back within an hour, give them a chance, because we are just swamped during this time of year.
Knowledge is power, but only when you implement what you've learned to your own benefit. Tune in next time for even more powerful tips on the Sarah Finkelstein Show.
And by the way, feel free to look up my books. Easy Button for Medicare.com is my Medicare guidebook in a PDF version, so you don't have to buy it. And also my first book, which I wrote, which is Wisdom for Women. Discover the challenges you must overcome to live the life in retirement you deserve. Yes, I know it's a mouthful, but you can go to sarahsebook.com, and it's a very easy read. And also you can get the free report. Just go to financialfitnessforever.com and learn what you need to know.